Welcome back to AOB. Today's lecture is the second one of the course Analysis of the Beauty. In this lecture, we are talking about the regional difference of concept and perspective of contemporary beauty from the viewpoint of the plastic surgery. The recent surge in the number of people seeking aesthetic facial surgery is a testament to the emphasis placed on one's looks as a way to gain considerable leverage in society. As we discussed in the earlier lecture, the new movement also involves the concept of the eternal usefulness. Being young is considered attractive, and looking younger can improve the competitiveness of a worker. This trend, which started in the Western countries around the end of the 20th century, is fast becoming worldwide. Although we are under of COVID-19 pandemic as of now, Asia is the most actively growing economy in the world. When more than half of the world's population residing on this continent, the impact of any movement in Asia will be influential. With the population getting more affluent and with the increasing affordability of a higher standard of living, the past 10 years have seen many Asians seeking aesthetic procedures to enhance their facial features or to attenuate the aging process. Although the broad term Asians is generally used to denote people who originate from Asia, in truth, various ethnicities and races with different facial morphologies reside in Asia. West and South Asia stretches to Turkey and India, where Caucasoid people, for example, Turks and Indians, are found. In East Asia, where China, Korea, and Japan are located, people possess East Asian features. Although East Asian are grouped in the Mongoloid strain, along with the Southeast Asians, such as Indonesians, Thai and Polynesians, etc., the facial features among the Mongoloids are still quite distinct from each other. The picture I show you depicts the average of different beautiful faces as described by Dr. Lee. Indians, Chinese, and Japanese are all considered Asians. However, their facial features can be quite different. Due to Asia's long-standing trade routes connecting East and West, modern Asian cities are often comprised of multiple ethnic groups, reflecting the modern trends of international marriage and globalizations. There is a rapidly transforming effect of the globalization on facial features as well, although at this time we still see rather characteristic Oriental features among East Asians. Aesthetic facial surgery in East Asia has expanded and developed at an exponential rate in the past 2 decades. Such rapid progress has enabled us to develop surgical techniques suitable for Asians and to accumulate a considerable amount of experience. The new skill sets and experience have been translated into technical advancement and better surgical outcomes. Those experiences and advances in aesthetic facial surgery, more suited for Asians, are becoming more and more popular, especially among the more affluent Asians living in the Western countries. Many years have passed since the introduction of the specific techniques for Asian aesthetic surgeries. Much has evolved over the years, and the current focus seems to be on refining the technique to address the stigma faced by the Asian patients. Although we still find a handful of patients coming to the surgeon wanting to look like a particular public figure, many are steering away from that trend. Patients these days often request a natural-looking face and wish to enhance their current appearance while retaining their facial characteristics, and they especially want to prevent their plastic surgeries from being noticed by others. While embracing their existing facial characteristics, patients prefer not to look the same as others who desire the ideal composition of a beautiful face, albeit all similar looking. This has resulted in surgeons reinventing themselves and moving into the next level of aesthetic facial surgery, combining less invasive procedures with surgery whenever possible. The art of combining non-surgical and surgical techniques to create a beautiful face will no longer be based on a gut feeling, but is objectively being described based on the analysis of beauty. Okay, let's move on to the change in cultural belief and the modernization of the Asian thinking. The Asian desire for pleasant face is heavily influenced by the facial physiognomy, aka Guansang, in the past. The combination of pleasant-looking features described in the ancient book were illustrated with pictures of faces that dictated the future of a person down to the position of moles on the face and body. There were a realization of the need for an aesthetically pleasing face, but few other than Shustra, the Asian Indian physician who are known as the father of plastic surgery, ventured into the aesthetic surgical field. Individuals with pleasant-looking faces were more likely to be judged to have a good life and a good job, and those with unpleasant-looking features were often associated with socially less respectable jobs or even criminality. The latter type of faces were deemed inauspicious and still very much influence how a person is judged in modern society. Despite this, there was little development in this field. Few wanted to change their looks surgically, partly due to the unrefined state of the surgical skill at that time, and the strong influence of Confucianism all over Asia, which emphasizes the sanctity of the physical body as a sacred gift from our parents. Altering one's physical appearance was considered disrespectful to one's ancestors. As globalization and westernization exerted more influence in Asian society via Western media, the definition of beauty became associated with wide Caucasian features such as double eyelids and tall or well-defined noses. Fair skin is seen as the mark of class. One ancient saying in Japanese, Korean, and Chinese society goes, "A white complexion overrides three appearance flaws," emphasizing the long-standing importance of light-colored skin in multiple countries across Asia. This was reinforced during the Western colonization period, when the Europeans were present in Asia and enjoyed high social status. In the history of white people, nail painter even argued that the Caucasian produced the most beautiful race of men and that Chinese eyes are an offense to beauty. The ideal beauty of Caucasians were once the well-accepted definition of beauty in Asia. However, recently Asian countries have become stronger and more influential economically. Scholars have started to debate about the Eurocentric beauty and the phenomenon in Asia where it has become the norm to alter one's facial appearance using plastic surgery to be more westernized. With growing confidence within Asian society, however, Asians have started to embrace their ethnic features. The fusion of certain desirable Western features with Asian features is now seen as the ideal form of beauty in Asia. The key concept now is to blend attractive features rather than having a certain defined template, a concept that has been heavily criticized and is rapidly falling out of favor. The good looking features are, of course, those that suit a person's facial structures, personalities, and the person as a whole. Enhancement rather than alteration of the facial feature has become the new trend. Statistics show that up to 58% of women in Korea have plastic surgery by the age of the 50. Wow. The percentage is growing in their male counterparts too. The desire to obtain aesthetic plastic surgery is often driven by the psychosocial aspiration of the patient. Rapid development in this field is largely driven by the need to appear more attractive in order to be better accepted in society that places a lot of emphasis on beauty and pleasant appearance. Looking more beautiful becomes an investment to achieve higher socioeconomic status and to ensure one will find a wealthy romantic partner. Thus, a new culture or trend has emerged, unstoppable by past cultural beliefs and taboos, and strongly driven by a novel concept of beauty, wealth, and a good life. As this concept has grown, the subject seeking cosmetic enhancement have become younger and younger. As Korean dramas and movies have become more popular throughout Asia and worldwide, so has the influence of the Korean definition of beauty spread all across the world, especially in Asia. This phenomenon of Hanryu, the Korean trend, was popular among viewers of all ages. With attractive actors and actresses portrayed as a heroes and heroine, many fantasized becoming like one of them, which could be achieved by their altering their looks. Trends becoming a strong driving force in the development of aesthetic surgery in Asia, enabling surgeons to grow and achieve a new level of understanding aesthetic surgeries. However, it's up to the conscience of individual practitioners to guard the sanctity of this field, preventing the double-edged sword of harm to our patients and to the practice of aesthetic surgery by prescribing only appropriate and scientifically sound procedures to patients and providing the best surgical practices tested by time and experience. Okay, now let's look into the anatomic differences and their implications. Most East Asians share the phenotypic features represented by the Mongoloid profile. It is currently the most widely distributed physical type, constituting over a third of the human species. Therefore, it is not surprising to find that many living throughout the Asia share the same facial features. Mongoloid features are typically represented by the apicanthal folds and neoteny, while some features such as the single eyelid and maxillary protrusion are not common among Westerners. They are widely encountered in Asians, with double eyelid surgery being the most popular plastic surgery sought. High cheekbones, a broad mandibular angle, and a low nasal profile are features in Asians that are not highly favored and are often associated with aggressions and manliness. Generally, a well-projected nose is preferred. A low nasal bridge is not limited to Mongoloids. The Malay people found in most of Southeast Asia across the Philippines, Malaysia, Thailand, and Indonesia often request changes to address a low nasal bridge and a wide flowing ala. Because the anatomy of the eyelids, nose, and facial bones in Asians differs significantly from that of Caucasians, a unique management strategy is required to successfully improve the aesthetic outcome. The management strategy should be aimed at handling anatomic issues specific to the Asian faces, such as the following. Number 1. The pretarsal skins of the upper eyelid is not attached to the levator palpebral muscles, leading to a poorly defined superior palpebral fold. The construction of a double eyelid that suits the morphology of an Asian face is different from practicing involving Caucasians. Excessive fat is distributed between the orbicularis oculi muscle and the levator muscles with relatively thick palpebral skins and orbicularis oculi muscles. Number 3. Orbits are smaller with a more protruding orbital margin compared with Westerners. Therefore, recreating the feature of Caucasian eyelid has proven unsuitable. Aesthetic eye surgery should be refined and subtle rather than dramatic, or it can give rise to a thick, deep upper eyelid which is not suitable for smaller orbits. Number 4. The nasal sclera triangle is rounded due to the prominent medial epicanthal fold. There are a variety of techniques to eliminate the obtuned angle, and there are their pros and cons. 2. The narrow and relatively small palpebral aperture resulted in smaller eye. This has resulted in many techniques invented and modified over the past decades to increase the palpebral aperture by lateral canthoplasty. Proper consideration of anatomy involved in lateral and medial epicanthoplasty should be given before the surgery is done to prevent later complications such as the lower eyelid ectropion. Number 7. There is a smaller nasal pyramid with shorter nasal bone length in Asians compared with other ethnicities. A study done by Nasal and Borogeny concluded that the nasal bone length studied in the skull of Korean was smaller than in American Indians, Anatolians, Iranians, and African Americans. The soft and small nasal septum encountered sometimes poses difficulty to the surgeon needing a cartilage graft from the nasal septum. Due to this, the use of homologous and autologous rib cartilage graft has become popular when synthetic implants are not suitable or not preferred by patients. Patients should be adequately counseled, as the likelihood of needing a rib graft is higher in Asian patients. Number 8. The nasal skin is thick with abundant sebaceous gland. This makes maneuvering the nasal tip substantially more technically demanding. Number 9. Asians possess different skin properties compared with other racial groups. Asians are known to have a thinner stratum corneum, the smallest in terms of pore size and pore numbers, and the highest water and lipid content in the stratum corneum compared with other peoples. Their skin is also known as to have the weakest chemical barrier. All these characteristics signifies that topical drug penetration is the best in Asian skins and that the formation of the wrinkles is less in Asians. Such anatomical differences in the epidermal layer of the Asian skin make management of scars and skin lesions different in Asian populations. Number 10. Asians have a high malar prominence due to a prominent zygomatic body or arch. Number 11. The broad mandibular angle is associated with masseter hypertrophy. Finally, number 12, Asians' hair is thick and coarse, is round in shape and grow faster. Asians also have a high prevalence of curly hair, but thick and straight hair is predominant among East Asians. All these anatomical differences in Asian hair compared with Caucasian hair require hair transplant equipment and procedures that are different from those that are conventionally used. To successfully address the above issues, one should understand the unique anatomic presentation of Asian face to properly modify and make refined adjustments to the generic technique presented in earlier textbooks. Okay, now let's touch briefly the modification of refinement of surgical techniques. To enhance existing Asian facial characteristics, refinement of the techniques is often required. Such refinement is well illustrated by various techniques of epicantoplasty to address a slightly different curve of the medial epicanthus, suturing techniques to make eyes with ptotic or puffy upper eyelid appear larger and more relaxed, and lateral canthopexy to achieve a more attractive and lively appearance of the eyes. The conventional method of epicantoplasty, such as YV and VW and W-plasty, were noted to give rise to unsightly scars. As surgeons in Asia accumulate more experience, many new techniques are developed, such as the palpebral margin incision method, with other commonly combining blepharoplasty with medial epicantoplasty by extending the incision, resulting in the obscured scar. With the increasing number of lateral canthoplasties done to widen the palpebral aperture of an Asian eye, complications such as the hypertrophic scars and scar contracture causing the palpebral fissures to become narrow again are possible. The procedure may also result in the asymmetrical result due to the unpredictable scar formation. In case where the lateral canthal ligament is cut to achieve maximal opening of the palpebral aperture, lower eyelid ectropion and the sagging may occur in the future as the soft tissue and muscular support is weakened. Therefore, such surgery are never to be taken lightly and should be done only after sufficient risk and benefit assessment. Such refinement in surgical technique is also seen in the rhinoplasty surgeries when more versatile use of the alloplastic material such as Gore-Tex and homologous cartilage in reconstruction of the nose. Nasal augmentation is rarely a need for the Western patient. In contrast, almost every East Asian patient requests nasal dorsal augmentation. In the past 2 decades, we have seen the popularity of the silicone implants for and subsequent increases in acceptance of Gore-Tex as more versatile implant material. Although the use of the silicone implant is declining due to the higher complication rate and the rigid appearance of the nasal dorsum, we see a current trend of surgeons carving silicone implants more judiciously, get rid of the L strut, and combining the use of the implant with other soft tissue to produce a softer and a natural look and reducing rate of implant extrusion. This allows the surgeon to continue using the silicone implant, which does have some advantages compared to other choices of implant. On the other hand, continuous trial using autologous costal cartilage for dorsal augmentation have shown much improvement over the years with improved reliability and consistency. We have seen a shift recently toward the increased popularity of the autologous graft compared with synthetic graft due to the superiority of the autologous graft in the resisting infection and preventing long-term complications. Understanding the specific anatomic differences in Asia has enabled us to combine the use of various adjunctive surgeries and procedures with rhinoplasty to produce a more favorable outcome than is possible with just rhinoplasty alone. Some of these procedures include paranasal implant, chin implant, nasal ala, resection, and columella lengthening flaps to address issues like maxillary retrusion and retrognathia, wide nasal ala, and short columella respectively, which are common problems found in Asians. Asian surgeons have also perfected their skills in malar reduction, which is more a common procedure in East compared with the West. Previous experience has resulted in some cases of facial sagging, facial asymmetry, or downward movement of the malar point. The reduction of the angle of the mandible is also a common aesthetic surgery in Asia as opposed to the West, as of the look and the V-shaped face are strongly favored in Asia. Asian surgeons have substantially more experience when it comes to this kind of skeletal reduction work. Other skeletal alteration surgeries that are popular in Asia include orthodontic surgery such as bimaxillary advancement reduction or mandibular reduction advancement, which can be solely for cosmetic purposes. These surgeries were originally intended to correct congenital deformities related to functional problems such as the malocclusion. As the appearance of protruding mandible and retreating maxilla is unattractive, patients these days are willing to undergo surgeries even without functional problems and even when the risk of the associated complications outweighs the benefit. The growing popularity of fat grafting has improved patient satisfaction tremendously. Fat grafting procedure is a long-lasting effect in facial rejuvenation. This is especially true in the younger patient in whom a surgical facelift would prove too drastic and destructive. It also plays an important role as an adjunct to many cosmetic procedures. Fat grafting techniques have progressed from the use of the crude fat lobules to microfat graft, giving rise to improved longevity in the recipient site. The use of fat graft is also very popular to improve the contour of the facial topography, proving to be very versatile in creating whatever topography is desired. Finally, the hair restoration has become a popular procedure done for aesthetic purposes in Asia in recent years. It is not only popular for males experiencing androgenic hair loss, but also for females who wish to reshape the face and to soften the outline of the face by altering the hairline. More females are seeking hair transplant procedure to extend their hairlines at the temporal regions, thus reducing the masculinity of the face or to change the face to a more favorable oval shape. Hair transplantation is quite different in Asia. This is due to their thicker and coarser hair structure, a broader base for their follicles, and the higher incidence for keloid-forming scar compared to the Caucasians. Therefore, follicular unit extraction and the use of the micropunch designed to minimize the scarring and maximize the hair follicle extraction have become more popular than the conventional single-strip harvesting technique. Due to the thicker and coarser hair found in Asians during follicular unit extraction, the direction and depth of scoring must be precise and the base has to be broad enough so that the germinal unit of the hair will not be damaged. As curly hair is more common in Asian than in Caucasians, the direction of the implantation has to be considered so as not to have unnatural hair growing in different directions. On the other hand, facial hair removal using laser should not be omitted for aesthetic purposes. The width of the forehead forms the shape of the face in the superior third. The forehead is also the location of the chakra where the third eye or sixth sense reside as per Sanskrit scriptures. A narrow forehead puts too much emphasis on middle and lower parts of the face and is often associated with lack of radiance. A balanced forehead can be created a permanent removal of the appropriate amount of hair with least problem of the dyspigmentation in Asia, who generally have darker skin tone. And the YAG laser has proven to be a good choice for hair reduction in Asia compared with conventional diode laser and was found to be superior in hair reduction. Many studies are still being actively conducted on laser hair removal regarding the paradoxical effect of the fine hair growth post removal. Okay, if we summarize today's talk, um, Asians, particularly those in East Asia, have seen rapid development in the field of aesthetic facial plastic surgery, especially in the refinement of Asian specific technique over the past 2 decades. The typical Asian belief is not altering the physical appearance of one's face, attributed to respect of the elderly and the one's ancestors, have evolved with globalization, resulting in a more neutralized Asian culture, which is a cross between East and West. More Asians realize that to be at the leading edge of society, an attractive appearance plays an important role in determining success. There has been a shift in social acceptance of aesthetic surgery, and we see more demand for it than ever before. East Asian features of the face are discussed in detail, with particular attention to single eyelid, small palpebral aperture, flat nasal bridge tip, malar prominence, broad mandible, retreated premaxilla, and many other Asian-specific aesthetic surgeries. Common aesthetic surgery of East Asians are double eyelid surgery, epicantoplasty, rhinoplasty, facial pore contouring surgery, fat injection, and many other techniques. Newer techniques, including the combination of non-surgical techniques in facial rejuvenation, such as fillers and botulinum toxin, and a laser hair removal and hair transplantation specific to the East Asian characteristics, are shortly discussed. The pros and cons of non-surgical techniques such as the laser and ultrasound for facial rejuvenation are being discussed among experts, whether the latest technologies and the options available to achieve the desired outcomes. Okay, this is the end of our lecture today. Thanks for watching. The next lecture will be about the traditional facial measurement. See you.